The word virus, or more specifically coronavirus, has been on the tip of everybody's tongues as of late. And as a general population, we probably know more about viruses now than we ever had before. But like many, even the slightest cough, sneeze, headache, or chill probably caused even the most rational person some degree of concern. And if you're like me, having our allergy season overlap the COVID-19 crisis only caused even greater paranoia. Ed Neuzil, board-certified advanced practice registered nurse at Allergy Sinus and Asthma Family Health Center, shares a refresher course on the difference between a cold, flu, virus, and allergies so you can better diagnose the drip.
Well, now understanding cold and flu, are two different animals, okay? Cold and flu are both viruses, but the symptoms are dramatically different. So when we're looking at the colds generally are more of an upper viral infection. They can affect the nose, the throat. Very commonly, I have patients come in and they say, well, my throat was scratchy the other day and it was a little bit hard to swallow. It's getting better, but now my head's all stuffy and my nose is plugged up and it's running, but everything is clear. Okay, so that's generally more of cold-like symptoms. Flu, you're generally looking at something a little bit different. You can actually have the nausea, with or without vomiting. You can have gastric cramping. You can have diarrhea. These are more of your flu-like symptoms. So the flu vaccine is a must, for individuals that can actually tolerate it. So there's a big difference between the cold and flu. Now, what happens with a virus? They can actually predispose you to develop bacterial type infections because of the inflammation, because of the mucus and the fact that it may not drain appropriately. Now the normal bacteria that we have in our bodies can actually what they call colonize. And so now, even though you started out with a virus, you can now develop that bacterial infection. Cold and allergy symptoms are very difficult because they share many of the same symptoms. You can get a runny nose, stuffiness, pressure, headaches. The thing that you won't get with allergies is a fever. In a viral condition or in a bacterial condition, fever may be present. And the other thing, when people say, oh, I get a cold all the time this time of year, generally is an allergic response because there's no reason why in the spring you should always end up with a cold. So you want to look at, am I having this all the time? Is it something that only happens at a certain time? Do I have a fever? Another thing with allergies is you can get itching. An itchy nose is not a viral condition, especially if all the drainage is all clear, your nose itches, stuff's running down the back of your throat, you're clearing your throat a lot. Those can be just due to allergies. Now the treatments sometimes can be similar, but in allergies you can use an over-the-counter antihistamine to help. I don't really recommend a lot of decongestants, although it does help in drying up some of the drainage. It can cause inability to sleep at night, so there's insomnia, can increase heart rate, increase blood pressure. So we really want to be judicious in our use of the over-the-counter medications, and I tell people that if they do want to use them, discuss it with their pharmacist so they can help direct them in the right way.
We also wanted to mention that Ed is in the final stages of opening a second office, this one in Brownwood, next to 2J's in the Villages. We'll be sure to keep you updated on the status and grand opening on the Hometown Health Facebook page and give you an inside look in the coming months. To get in touch with Ed Neuzil and the staff at the Allergy Sinus and Asthma Family Health Center, please visit our specialist directory. Just click the Diagnosing the Drip story link icon on our homepage, yourhometownhealth.com.